OTA student at the Costco Community College, and I'm going to start explaining to you what the gluteus maximus is. The gluteus maximus originates at the sacrum in the ilium, and it inserts at the distal femur to the greater trochanter. So an easier way for me to find the sacrum is, I'm going to start with the PSIS, which is like the dimples on the back. And I'm going to work my way down so I can feel the sacrum. So here's the sacrum. And I'm going to stop until I feel the coccyx right here. And so now I know where my sacrum is at. And here is the ilium. Right here. And this muscle descends down into the distal femur to the greater trochanter. And so where I can find the greater trochanter, I'm going to ask you to bring your your foot up to your buttocks. Bring your leg back, I'm sorry. And I'm going to... So here is the greater trochanter. So that's where I know it inserts. What this muscle does is hyperextension of the leg and the knee, and then it does lateral rotation. So I'm going to ask you to bring your whole entire leg up. There's extension, and bring it a little further. Hyperextension. All right, put it back down. All right, and just kick your knee back. Your foot back. I'm sorry. To form lateral rotation, and have her bring it across her body. Okay. Thank you. All right, now we're going to go to the bicep femoris. The bicep femoris actually has two heads. The long head originates at the ischial tuberosity, and then the short head originates at the linea aspera of the femur, and then it inserts at the fibular head. So an easier way to find the ischial tuberosity is use your lip of your buttocks when you sit down. So here's where I know my ischial tuberosity is. Then we go down to the linea aspera. And I'm going to feel this muscle fiber until it thins out. It's going to start thinning. And then inserts the fibular head. What this muscle does, the short head does flexion at the knee. If you can just bring your foot back to your buttocks. Thank you. And the long head does flexion at the knee as well. If you can just bring it back again. Thank you. And it does extension of the hip. So if you can just bring your whole entire leg off the ground, an extension of the hip. Alright, so now we're going to do the gastrocnemius. So the gastrocnemius originates at the lateral and medial condyles of the femur, and it works its way distally into the calcaneus. Alright, so we're going to start with the condyles of the femur, and I can tell this muscle's coming up. Ask my patient, can you bring your leg back towards your buttocks? I'm going to press against you. So here I see the muscle, and it starts at the condyles. Here's the condyles of the femur. I'm going to work my way. Here's the muscle fiber. All right, you can relax for me. And you can see it thins out. And right there, the calcaneus. Calcaneus. And what this muscle does is plantar flexion, knee flexion. So I'm going to ask my patient, press on against my foot like you're pressing the gas pedal. And you can see the gastrocs. All right, you can relax. And then can you bring your foot back to your buttocks? All right, and it does knee flexion. All right, thank you.